This morning, we want to help you better understand the risk and warning signs of the three most common gynecological cancers in women. Dr. Daniel Benrubi is with UF Health and is joining us this morning in studio. Good morning, Doc. Thanks for being with us.
Good morning, Jennifer. Thank you for having me.
So, we've talked a little bit about this, and there are three in particular. I mean, first, in no specific order, the most common cancer, gynecological cancer, is endometrial or uterine cancer. Are there any warning signs that our female viewers should be aware of?
Yes, there are. The most common is abnormal bleeding. For older women that have already gone through menopause and haven't had a period in more than a year, any bleeding that happens after that is considered abnormal, and a woman should see a gynecologic healthcare provider. We need to make sure that that is not uterine cancer or precancer, and that bleeding needs to be explained as to why that's happening, because any bleeding after menopause is not normal. And for younger women that have not yet gone through menopause, they need to be on the lookout for any heavy bleeding during periods or bleeding in between their menstrual cycles, as that also can be abnormal, especially younger women who may be overweight or obese, as those are risk factors for endometrial cancer and uterine cancer.
And doctor, there are some women who may be taking some kind of medication that prevents them from having any kind of menstrual cycle. And given that, they may not be aware of the fact that they could, have an issue associated with either of these cancers. Is there some kind of test that they could undergo, perhaps if they are considered high risk, that would identify this type of cancer earlier?
So there's not a universal screening test. However, if there are other symptoms such as abdominal pain or bloating, or if there are other issues that a healthcare provider detects, there are tests that can be done, in a biopsy that can actually be done in the clinic as opposed to the operating room, could help detect it. But the key thing is for a woman to see her healthcare provider in order to figure that out.
So the next most common is ovarian cancer. This is considered a silent killer. Why is that?
So ovarian cancer, one of the toughest cancers for us in GYN oncology to treat, because its symptoms fit with so many other symptoms. Oftentimes the symptoms for ovarian cancer are bloating, abdominal pain, getting full early when you eat, and having feeling that your waistline is increasing. And those are all things that a lot of women and even some doctors will sort of chalk off to gastrointestinal symptoms. But if there's not a quick resolution to those symptoms, and if they continue, and if that can't be explained with GI workups, then ovarian cancer needs to be something that's on everyone's mind.
Are there any genetics involved, that should increase, maybe a woman's, maybe not just yearly, but even sooner than that, exams associated with other family history?
Certainly. Family history is actually one of the most important things with ovarian cancer, as there are people that carry genetic mutations such as BRCA mutations, which affects both breast cancer and ovarian cancer, as well as Lynch syndrome. So if you have a family history of anyone that has had breast or ovarian cancer, you need to speak with your doctor about some genetic screening.
So there is another common cancer. We talked a little bit about this when you joined us about a week and a half ago. And this can actually be caught early. It's cervical cancer, and it can be caught with essentially a yearly exam.
That's correct. So cervical cancer, many of us say that no woman should get or die of cervical cancer, and that's because we have a good screening test. The Pap smear has been around for ages, and it's still an excellent way to screen.
And then also, you can prevent essentially what is the most common cause of cervical cancer by simply getting vaccinated. And we're talking about the HPV, which is available to younger people, to girls at this point, as well as boys.
That's correct. It's important to consider getting both boys and girls vaccinated, as that can prevent the overwhelming majority of HPV infections that can cause this cancer. The other thing that kids can do is to not start smoking, as smoking is a risk factor for cervical cancer as well.
And I do want to point out, are there any side effects that you're aware of? Because we have discussed this previously. There are a lot of parents that, for whatever reason, are hesitant about allowing their 11 or 12-year-old to get the HPV vaccine.
So these vaccines have been around since 2006. They're well studied. There have been no major adverse side effects for these vaccines.
Dr. Benrubi with UF Health, thank you for your time this morning. We appreciate it.
Thank you for having me.